And basically when we do a treatment, and this is the interesting part about it, is when we used to do varicose vein stripping and ligation, you had to be off your feet for a while, there was a recovery time and so forth. When we treat veins nowadays, and let's talk about the most aggressive treatment, which is the laser treatment for the really large veins. When we do a laser treatment, we do it at the med spa. It's done in an operating room-like conditions where we wear gowns and gloves and everything's sterile. But literally, you go home that night, you put your legs up for one night, the next morning, you put on your support hose, you get back on your feet, and you go about your business and do your thing. There's no downtime. We have done it on runners. And the only thing that they notice is it pulls a little bit because the vein's not flexible anymore because you've injured it, but they still go running. We actually don't like you to sit for long periods of time after you've had it done. We'd much rather have you up and about and walking. If you're in a sitting job, we actually have you do leg exercises, keep pumping your veins to keep the blood flowing. And basically you wear a support hose for a month and then you come out of your support hose and you're fine. With the sclerotherapy, there's not even put your leg up that evening problem. You basically just put on your support hose and go about your business. So those are the kind of things that we treat. If anybody has ever seen someone who has discoloration of their leg where it almost looks like a stocking on their lower leg, or sometimes you'll see it on people's ankles and feet will be a darker color than the rest of their leg, that's an indication of venous disease. All of these things are covered by insurance because it's not cosmetic. This is a problem, people having pain and swelling and so forth. There are a lot of things you can do yourself to avoid having all these procedures done, or at least to start treatment. And the biggest one is wearing support hose. If you wear support hose, especially if you're in an occupation where you're on your feet, it really does help your superficial veins. So in as much as you're in an occupation where you're going to be on your feet a lot, the better grade support hose you wear, the better off you're going to be in the long run. However, some of this you can't avoid. We do find vein disease runs in families. It's in the genes. And if your mom had bad veins, you're likely to have bad veins. But fortunately, your mom didn't have these kind of treatments when she had these problems, and you have access to those treatments, and they're not as vigorous as they used to be. The last thing that we do is the cosmetic treatment of veins, and I'm not going to go into a lot of that today. We prefer to do a lot of the cosmetic treatments starting in the fall because it takes a while for your body to resolve the veins and to get things looking better. So we generally start with the larger procedures and the more complicated procedures this time of year so that we have those behind us, so when you get to the fall and the summer's over and you're ready to work on getting your legs looking better, we can start doing cosmetic things. So that's pretty much leg veins in a nutshell. I guess the only other symptom I neglected to mention, and some people will have this symptom and it's kind of interesting. Some people have what are called paresthesias of their legs. And the most typical response I'll get from someone is they feel like bugs are crawling up their legs. And that also is an indication of vein disease. But generally that comes after somebody has already had pain of their legs and swelling in their legs and so forth. So it just means it's more significant or more long-standing. So I've kind of given a really brief overview, and I wanted to leave some time for questions. And feel free to ask any questions about any of this. Go ahead.
If you go and fill out these veins, doesn't your body need these veins for some purpose? Do
Okay.
veins grow?
That's a great question, and I probably should have covered that. Because people always go, well, the veins must be there for a reason. Where does the blood go? And what usually will happen is the superficial veins drain into the deep system. So when they start to give out and you treat them, the blood just gets shunted away from the skin to the deep system, which has better support anyway. And that's the whole gist of the therapy. So when they were doing varicose vein stripping and ligation and the veins were gone, the question is, where does the blood flow? Well, it just flows into the deep system. And there are connections between the superficial and the deep system all along your leg.
But you don't need this superficial system?
You really don't. You really don't. The bigger veins in the superficial system you can't see. I mean, you have to have an ultrasound to find them. So the ones that you see, and if you look at someone who's really young, you can't see any veins. I mean, they're just not there because they're very small. As they get dilated, then that's when they become apparent. And what happens over time, basically, is the vein, because you're standing, it's hard to fight gravity, as we all know. I don't know how many people have stood in front of a mirror and gone like this to see if it looks better, fighting gravity. And your veins are very much the same way. And what happens is, as time goes on, because these superficial veins have no support, they gradually dilate. And veins have valves, and the valves keep the blood flowing in the right direction. And as long as the valve opens and the blood flows up, and then the blood tries to come back and the valve closes, you're fine. But as the vein dilates, the valve leaflets get farther apart, and now there's a hole. And they can't do anything. The blood just goes right through the hole. And that's when you start having trouble with vein disease. But that's a very good question. Yes, ma'am?
Would wearing the support stockings help with restless leg syndrome
Yes, it will.
at nighttime?
It will. Now, it's going to be hard to sleep in that at night. But it really will, because what you're doing is you're basically helping the leg to empty so that those veins don't exceed that certain pressure point that then triggers by reflex that muscle to contract. So it actually will help. Probably 25% of people with restless leg syndrome have vein disease. Now, the 75% don't. I mean, there are obviously other causes for restless leg syndrome. But that's one of the biggest ones that's very treatable, and you can take a lot of people off medicine if you find out their veins are a problem and you treat them. Yes, ma'am?
I have a question. If you have CDI and you have the veins taken care of, and somewhere along the road you need to have a heart bypass, where do they find the vein? Is there a replacement?
Well, there are lots of veins.
Well, yeah, but would they do the healthy thing that could still do it?
Mm-hmm.
Well, I remember I had a friend whose mother was a nurse.
Right.
And she had all her veins stripped.
Right.
And then she had a heart problem, and we were kind of wondering what they were going to do. They talked about a triple bypass.
Mm-hmm.
And I was wondering what,
Yeah, but I mean, truthfully, when they do that kind of surgery, they're really going to want a healthy vein anyway.
Yeah.
They're not going to want a diseased vein.
No.
So if that vein is not functioning well now, it's probably not going to be a good candidate for bypass surgery anyway.
Well, it's after the fact that can be done, so.
Right.
And I'm
Right.
glad.
But I mean, in a way, you're kind of correct, because the veins that typically give you problems are very often the veins they look at as, is this a vein that's going to be good for that particular surgery? But like I said, if it's a bad vein, they're not going to want to use it anyway. So, yes, ma'am.
So what's the best thing to do for a vein that's had a big blood clot in?
A superficial vein? Okay.
Like the flow vein.
Veins with blood clots, that's another reason that we look at people's veins sometimes. People who have recurrent problems with, it's called superficial phlebitis, where the blood vein clots, or the blood in the vein clots, and then you develop inflammation around the vein. And typically the treatment for that is to elevate your leg, to put heat on your leg, and most people either take aspirin or ibuprofen, and then it resolves over time. The treatments that we use actually cause phlebitis, and that's how we treat those veins. So, and the other thing which would help that too is support hose. But people who have recurrent problems with superficial phlebitis very often get referred to us by their family doctors, and we will look at them to see if there's underlying vein disease. Because phlebitis means the blood's not flowing. I mean, as long as blood is flowing, it's not going to clot. So when you get superficial phlebitis, that's usually an indicator that the blood in the superficial veins is not going where it's supposed to go.